Let's talk about why Cushing's Triad happens in patients with ICP. First, let's think about the brain. It lives in a hard shell, and inside of it is brain tissue, blood, and cerebrospinal fluid. And there's only so much room. So if any of those things is increased, you're going to have pressure. So trauma can cause bleeding, meningitis can cause inflammation. You can also have increased CSF. So when pressure increases, basically it's compressing on those blood vessels that are bringing blood to the brain, which is bringing oxygen, and now the brain is starting to die. So first on Cushing's Triad is going to be bradycardia. And the reason for this is all of that pressure and swelling, it is pushing down on your vagus nerve, and your vagus nerve is what activates your parasympathetic nervous system. So that's going to cause your heart rate to slow down. So the bradycardia is not the body compensating for anything. It's literally just a response from the vagus nerve being compressed. Second is going to be a widened pulse pressure. And what this means, because no one ever explained what this meant to me, they just said widened pulse pressure. It is the difference between your systolic number and your diastolic number. So if your systolic number is 120 and your diastolic is 80, then that number would be 40. You want that number to be between 30 and 50. And the reason that it's a widened pulse pressure range, is because the systolic is always going to be higher and the diastolic should stay within normal range, or probably around whatever the patient's baseline is. And what's happening is the brain is freaking out and it's saying, we're not getting enough blood because there's too much pressure. So basically the heart is just saying, whoop, and it's trying to shoot that blood right through those compressed blood vessels. So that's why the pressure is so high, because it's trying to push through all the pressure that's surrounding the blood vessels. And finally, decreased respirations and irregular breathing, such as Cheyne-Stokes. And that's just because our brain is what tells our lungs to breathe. And so you're not getting any blood, you're not getting any oxygen, so the tissue is dying, the brain is dying, and no longer able to tell the lungs to keep breathing in and out. So that's why you have that final symptom.